So today we are working with Ilya. He's come to the clinic. We've been working with him for about 6 weeks now. He's 9 weeks post-surgery. He's a volleyball machine. In fact, he tested as, for his age group, the fastest spike for the Ontario team trials that they were having. But unfortunately, he tore up his knee a little bit. He's had to correct that with surgery, and we are now trying to get him back to better than he was before his injury. His surgeon thinks he's about 9 to 12 months away from returning to play. I think he's a little bit ahead of that, but I like to under-promise and over-deliver. A lot of cases, athletes are working on the motor of their system, but they forget to work on the chassis or the suspension, so to speak. So those supporting elements and what drives those functional movement patterns are often forgotten, in the goal of getting faster, stronger, more powerful. So we're going to address that in his rehab, and hopefully you'll come along and enjoy the journey and learn something from it. You're going to step up here. Let me just measure your tibia links. Okay. Right, so you're going to touch your heel and back 3 times. Keep this as straight as you can. Touch the heel, back, straight as you can. Okay, not bad. Up. Good, okay. This side is a little bit tighter because you've been compensating for that bad wheel, right? The right side is taking a little extra. We're not only rehabbing you for the neurological crossover effect, but because this leg has taken a lot of pressure the last few weeks when you were in that brace for so long, yeah? So I want you down as straight as you can, arms back and everything, right? And you're gonna squat back and down as far as you can. So hips, shoulder width apart. That's pretty good. Back straight. Any pain? Good. Try to keep that back straight up, yeah? Yeah, that's pretty good. So about there. Don't go down too far, just go where you're comfortable. That's your ankle mobility affecting that deep squat pattern. So we've got some issues with ankle mobility on both sides. Keep that back straight. So there's a little bit of T-spine mobility issues, but that's a lot of foot and ankle. Because once we take that foot and ankle out, you're almost like full, which is really cool. You're gonna place one toe here, one heel at 22, okay? Back is gonna be straight, right back down and up 3 times. And then your heel at 21. Good, and up, pretty good. Awesome job. Okay, let's get your straight leg raised. So you're gonna lie on your back. Keep this leg rock solid and straight on the ground. Where do you feel that? Hamstring, so tight, but it just limits you, right? Okay, let's see the other side. Keep that leg nice and straight and planted, okay? Same thing, so hamstring. Get in a good position, neutral spine. Straight, you're gonna lift this hand in front of you and this leg straight behind you. This is a rotational stability test. Good, out. Good, one more time. Okay, reset. Now we're gonna try this arm first and this leg together. Good. Okay, that's okay. Take your time. Does that hurt your knee with that pressure? No, good. Push through the heel here. Yep. Okay, good. And relax. Okay. Like a little bit more coordination, balance, connecting the core, getting the core active during everything, kind of that stabilizing hub of your movement. Start with the banded knee squat. Ilya's type of injury and surgery, in this particular case, we do not want to load him past 90 degrees of flexion for now. Once he's had his follow-up with his surgeon, we can start maybe incorporating that. But for now, basically his only limitation is anything that causes pain, and we're not loading past 90 degrees of flexion. That's gonna go above that left knee, right? And what we wanna do here is we wanna make sure that his hip is hinging, and we want his foot to be interacting with the ground properly. So I need kind of these 2 points, Ilya, and the heel, right? That tripod, that's where we want to focus your pressures as you're going down in both feet. Okay, so we're training his hip hinge here with good foot to ground interaction. Good, and back. Keep this up. Hey, you got the pressure there. Good, and up. Good. Go, 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 go. Here. And your hips move. As soon as your hips, you feel them stop moving, that's the end of your range, okay? You're not pushing more by lowering or sinking your upper body or bending your knees more, okay? Your knees stay at that a little bit of bend. As soon as your hips stop moving backwards, that's the end of the range, and then come up. Good. Up. So I need a lot of glute. You feel a lot of glute there. As soon as that, you can't push your butt back, you stop right there, then squeeze all the way up, right? And we're not gonna lock out here. We're just gonna come up to a light bend. I want you to feel here and kind of contract your quads at the end range. We wanna help contract his core to his other movements. So he's having issues in terms of his hamstrings limiting movements right now, which we would expect. But we're gonna address that by getting his core to behave a little differently when he moves. So you're gonna be straight, get straight there. I want you to put your hands through those and grab the sponges. Your arms are gonna stay very straight. You're gonna pull your hands down to your sides together. Okay, so we're gonna go down against that resistance. Really gotta brace there, good. Keep that, keep that, keep that, good. Now lift that right leg straight, keep the other leg down. High, up, stay in line. Yeah, keep that leg straight. Up, keep those arms straight, good, leg straight. Fight for height, fight for height. Are you? Good. Cool. No? Good. And we'll do some banded hip thrust. So we get that a little addition to the glute med, yeah? We need to maintain that abduction width, right? As we go through this here. So as you come down, breathe in through your nose. As you're coming out and squeezing out through your mouth. Fight for that width, yeah? Squeeze it up, good. Good, come up, come up, come up, squeeze. Okay, good, rack it. Okay, let's add some weight. Okay, we're not gonna go past an 8 on the RPE. Now remember those 3 pressure points, same thing, Ilya, right? Here, here, and the heel. And then just come up at a normal pace. Yeah, squeeze, watch your foot. That's it, good. Good, feel that hip push into the table, right? As you come up. Up, 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 up. Good, okay, other leg. We're training both legs separately because of what's called neurological crossover. So studies show that when we train the uninjured leg, the recovery on the injured leg is better and quicker and more all-encompassing. So that's why we're doing both legs individually. I really want you to push that hip in. I still want that glute to activate. I want to push this in here and almost feel like you're squeezing the glute before you start with the hamstring curl. It is rough. So can you be mindful of keeping your knee in alignment, like not letting it come inwards? Let's go, one more. Clean, 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 clean. That's what I want. Good, okay, recover. We're trying to build the hip and we're gonna build the ankle and his calf eventually, his core, his back, everything that works together to create his power. So a lot of this stuff is just teaching him how to start to move better in terms of his hip hinging, taking pressure off his lumbar spine, letting his knee, the alignment of his knee travel more efficiently. And that'll reduce the wear and tear on that knee joint and his risk of injury in the future. We're going not past 90 degrees again. Watch your contact points here, right? I need to see this foot stable. Right there, that'll do. Good. What are you feeling, you okay? You getting it in the muscle belly? Nothing in the knee. Perfect, right there. What do you feel out of 10 right now?
I would say 5 to 6.
Okay, we can add more weight. This is progressing really well. Yeah, you can go full heel. As long as you control that knee, we're good with depth. Okay, because when we start your power training, I want this already to be an ingrained pattern. I don't want to have to worry about what, contact points here, right? Here and here, right? Good. One more. Okay, that'll do. This is very important, this piece, okay? And this knee piece. You are shaking a lot. This is big improvement. Good job.
I'm feeling
Okay, good. This is a good weight. Okay, good. That'll do. Rack that. Okay, we're gonna do your balance piece now. Okay, hold on for now, just because this is gonna be new to you. Now we're gonna control the knee, right? And we're gonna try to correct at the ankle. So obviously we have to go through the kind of tedious exercises to build his strength back up. That's just part of great rehab that's going to allow him to be much more explosive later on and safer. After we do all these other exercises, we're going to add his balance component so that his body is learning kind of where his knee is now in space. His brain and knee, ankle and hip have to reconnect that neurological pathway to be able for him to understand where he is in space, and especially when he's in the middle of the air, how he's going to come down safely. You okay with that? No pain in the knee at all, right? Zero pain is what we want. Good. Easy, medium, hard? Medium? Okay, good. That's, I think, where we want to be right now, right? Okay, now, watch your left ankle wants to come in a little bit. Keep your weight evenly distributed on those 3 points. Watch that left foot a little bit. There you go. Awesome. Better than me, and I'm not hurt. I guess that's why you're an elite athlete. Yeah, you tend to want to come in a little bit on that left ankle on the inside of that arch. So let's try to keep that nice and neutral if we can. We don't want him correcting on the board with body sway. That's not what we're looking for. We're looking for a steady body, and I want him correcting at the ankles. The correction comes from your ankles moving efficiently, not from your body swaying, okay? Good. Good, you okay? I want you to drop your left shoulder. Let's stay nice and neutral here, yeah? There we go. Go less at the hips, okay? So good session today with Ilya. So when we were running through his functional movement screen at the beginning of the session, we picked up some things we need to address. So a little bit of ankle mobility, especially on the left side. He kind of wants to collapse in there. On the inside of that foot, which is not great for a knee issue, right? To be coming in like that or even landing on that from jumping. We want to train him to be more aligned when he lands and not coming in towards his knee with his knees together. And his core is weak when he's doing kind of compounded movements, which is not unusual. He was laid up for a few weeks. He was in a brace for a long, 3 to 4 weeks. So that's not unusual at this stage. His extremity strength is improving a lot, which is great to see. And we'll address those issues in terms of training around where his weaknesses are. So now I've identified where we need to kind of pinpoint a little bit more of his time. And in another 3 to 4 weeks, once he's had his follow-up with his surgeon, we'll be able to start a little bit more power style training and get him hopefully learning those jump patterns again, but safer.